Practice makes perfect, and this is practice number 38. 38 times. Well, today I'd like to speak about central line catheters because I didn't receive the most amount of education about these guys. And so I thought I'd give this a little draw on a whoop de whoop and see what I could come up with and see if we can make understanding a little bit easier. So, this is the anatomy of a central line. By the way, that intro probably sucked. I'm okay with it. Before we get started, my name's John. I'm an artist. I'm an ICU nurse and a nurse educator. I've been at the bedside for 12 years now, and something's wrong with me. But I take my artistic skills and my nursing skills and combine them together, and hopefully we can come up with some good educational resources that can help you learn a little better and to help you understand and put it in your brain where you could visualize it right then and there when you need it instead of flipping through a book. So let's get started on the anatomy of a central line. We use these a lot in the ICU, and they are large bore catheter devices that usually end up in the neck, right there. If this is not accessible, we go to the leg. But that's dirty. We don't want to do that. There's like bacteria and grossness and sweatiness in the groin area. You don't want to do it right there. But if we have to, you get it right there. Well, again, we usually go right here. IJ. I've seen it in the subclavian a few times. That's kind of cool. But again, right IJ. So this guy is getting put in by a doctor or a nurse practitioner who's been trained to do so. And this catheter is pretty neat because it's got 3 lumens. Let me make sure I got, yep. Does red work with you? The color red? I love red. I love crimson red. And this is not crimson. We'll deal with it. Anyway, we've got 1 lock, 2 lure locks, 3 lure locks. That's a fun word to say. Lure locks. We got lure locks. How many? 3 lure locks. So they're going to be color coded. You're going to have white, blue, and brown. And some facilities might have a different color, but you're going to catch the gist in a minute. So white is at the proximal end. It's like closest to the neck. And that's going to be a hole right about here. And if we take this and blow this up right here, you can't see that. So this is going to be your proximal port right there. It's going to be like right there. And this can infuse fluids, blood products, IV meds, and you could do some blood sampling from there. Ooh, blood sampling. I'll sample some blood. And then we've got, where was I? Medial right there. And that's usually blue. And so the blue is the middle guy, and that's going to be right about there. Ooh, that's a nice circle. I could do better. Right there. Right there. There, that's a good circle. And that is going to be like this guy if we took a microscopic view of it and looked at it. It would be right there. It would be in the middle. And this one, you can infuse TPN or more IV medications if need be. And finally, your distal port. Your distal is often brown. Brown in the ground, brown at the bottom. Ground is usually at the bottom. So, brown right there, right at the bottom. And that guy is just dumping IV fluids into the heart. By the way, this sits at the, I'm going to mess it up, cavoatrial junction. I think that's what it's called. But essentially, it's sitting between it's like at the SVC and at the right atrium. It should be right there where the SVC turns into the right atrium. You don't want to go in any further because it could tickle the right atrium, like the back end. And what's at the right atrium? Your SA node. It might tickle that SA node, and you might get you might get shocked, not shocked, but it might do a little tickle, might give you some arrhythmias. So you don't want this tip deep into the right atrium. I think that's it. Sorry. Hub and suture wings. That's the part that gets sutured into the neck or the groin. And don't forget your CHG disc. Your CHG disc is going to help prevent CLABSIs. And CLABSIs are crazy. Central line associated bacterial stream infection. Those things can cost a fortune. Those things can be like $20,000 or $40,000. I'll put a reference in there to show that I'm not making stuff up. So, I wrote something. Each lumen is independent, allowing simultaneous blood draws and fusions, incompatible meds, example given, Lasix and Versed, heparin and Protonix, and Levophed and sodium bicarb. You never want to put these two or these two or these two together. They could cause a chemical reaction within the body, which be detrimental to that body. So don't do it. Boom. So the staggered design helps prevent mixing of infusions. So you've got 1, 2, 3, and they're not mixing. Isn't that wonderful? They might be mixing way on down the road, but it's not making shit crazy. Well, I don't know how long that was, but I think this is a good start. My name's John. I have a website. It's called rnartline.com, where I infuse art with nursing, specifically ICU, trauma, and nursing. Please visit. I got some cool stuff there, apparel, field guides. I've got a whole book on central lines, 54 pages. Would you believe it? Took me over a year. You should check it out, rnartline.com. And the drill, follow, subscribe, all that stuff. Putting my pen down and bidding adieu. Happy nursing.